Hello, my name is Sandra Walker, and I am a MSN prepared nurse who works for a government healthcare facility, and I'm enrolled in the Naval Postgraduate School. I will be presenting today on utilizing exercise design and development with an intrinsic example. The following slide is a disclaimer of endorsement. The views of this presentation do not represent any government agencies such as the Uniformed Services University of the Health Sciences, the Naval Postgraduate School, the Department of Homeland Security, the Federal Bureau of Investigation, the Veterans Health Administration, or any specific technological company or entity. Any reference in this presentation to any organization or activities, products, or services related to such organization or any linkages from this website do not constitute or imply the endorsement, recommendation, or favoring thereof. Organizational exercise design and development require in-depth process improvement. We need to look at why and where to start, such as why are you planning an exercise? What are the foundational strategies that led up to planning the exercise? Is it required or mandated, or is it simply desired? If so, what is the purpose? With our background knowledge, we need to plan, design, and develop an exercise. In order to do this, one must gain the historical or background knowledge of the topic and the organization itself to project modeling and simulation for the event. With key stakeholders, we'll look at this and think and discuss the 6 P's of exercise design and development, which are utilized for planning strategies. Key stakeholders and leadership must be well informed in the organization and the community dependent upon the exercise. And then with our target population, we look at who will be your players, who will be your learners. Do you need standardized patients or actors? Is the event announced or unannounced? Is it a yearly mock exercise? Who will you be reporting to after the event? Organization platforms require attention to detail for exercise design and development. Let's look at 6 P's that are of value for any exercise planning. You need to be personally vested or passionate about your organizational exercise planning so that what you do matters and you are taking the appropriate steps to have optimal outcomes. What protocols are already in place? Is this new? How often is this exercise required? Know what protocols to go through for the exercise itself. You may have both internal and external partners, as we discussed previously. On your procedures, know your chain of command. Organizations have proper procedures. Is your exercise a drill? What procedures need to be in place in order for your exercise to happen? Put your ideas to paper and see what's missing. On your presentation, compile your modeling and simulation to present to key stakeholders. On your planning, prep, and populations, both plan and prepare and then simulate. Then do it all over again prior to the actual event. We discussed target populations a moment ago. Know who your participants or players are. Then for your post brief, you will have a debriefing after your exercise in order to garner feedback. Later, we will discuss a final few P's which we will add for consideration. One might ask themselves, why use exercise development and design? It is a state-of-the-art technology which can be utilized for organizational implementation in strategic plans to optimize positive outcomes for that which you are seeking. Let's look at an example and let's get started. A current hot topic to use for an organizational example for exercise design could be active shooter. Active shooters can occur at any time or place, so training is imperative to preparation and emergency response. We will take a closer look at worldwide emergency response preparedness safety platforms within healthcare institutions for patients and those who serve them, the employees. During such an event, we will determine what steps we need to take for exercise design and development of an active shooter. The Federal Bureau of Investigation, or FBI, reports that there were 277 incidents of active shooter that occurred between 2000 and the year 2018. There were 2,430 casualties, of which 884 were killed and 1,546 were wounded in these incidents. Mass shootings have increased each year to become a prevalent threat of violence not only in the United States but the world. It is essential to empower hospitals with the educational tools to protect self, personnel, patients, and organizational structure according to Wexler and Flam 2017. Even though hospitals, according to this pie chart, may be around 4% for active shooter events and government properties at 9%, in recent years, more and more government facilities have had active shooters. Hospitals contain crowded waiting areas and enclosed rooms with large number of people in confined areas. Let's hone our focus down to healthcare government organizations, and we'll break it down even more to focus on active shooter exercise design and development in these areas. Government healthcare facilities may produce an even higher risk for active shooters due to terrorism, professionally trained combat veterans, and an exponential or increased diagnosis of post-traumatic stress disorder, PTSD. The FBI deploys a user guide for emergency drills which define an active shooter as an individual engaged in killing or attempting to kill people in a confined and populated area. This definition reveals all hospitals may be at risk, although government facilities may navigate a soft target or vulnerable population by default of wounded warriors, those who cannot run. Modeling and simulation play a vital role in active shooter. Several initiatives we would look at with active shooter are the hazard vulnerability analysis, which identifies organizational hazards, assesses risk, and analyzes findings. It's often used in emergency management. We want to formulate and educate and have a strategic implementation plan for the exercise. We would look at simulation versus live actors or utilizing both. Consider who is your team, who is your population. We would have mental health involvement, which we will look at later in this presentation. And then we would have a debriefing or after action plan for improvement. Now we're going to look at our resources. There are numerous active shooter resources available with a simple Google search. However, since we are looking at our current example in this presentation, which is for design and development of an active shooter event within a government healthcare organization, let's look at two particular government resources. Although remember, there are many more available today. Active shooter campaigns embody federal agencies such as the Department of Health and Human Services, the Department of Justice, the FBI, and the Federal Emergency Management Agency, along with the Department of Homeland Security, who have created directives to mitigate this process for community and healthcare populations. DHS, or the Department of Homeland Security, and the FBI website have multiple platforms, including but not limited to an active shooter guide on how to respond, a video and pocket card with good practices if an active shooter is in the vicinity, all of which include run, hide, fight verbiage. Run includes multiple aspects of evacuation, assisting others, barricading doors, and calling 911. If evacuation efforts are not optional, hiding may incorporate remaining unseen and unheard, barricading or locking the doors, placing cell phones on silent, turning off lights, noise, or pretending to be shot if in full line of vision. Finally, fight is the very last resort and is only recommended if life is in imminent danger, utilizing items within the immediate environment to fight back, yelling, and trying to incapacitate the active shooter. Ensure you use current, relevant, evidence-based best practices and a point of expertise in your exercise. In our design, we want to look at innovative measures to ensure optimal outcomes for the exercise. What adjuncts, realism, and simulation can be utilized in development to enhance the experience for the learners and improve retention of clinical skills and critical reasoning. Use of simulation equipment and modeling of active shooter infrastructure events, along with post-event measures, will optimize utilization of resources for the staff, patients, and other populations involved. A majority of victims may hemorrhage or bleed out after an event before emergency services can locate the active threat and assist the victims. Therefore, hemorrhage control would be a vital component to add to this event. This training would also be conducive to all staff at all levels for maximum spread of life-saving measures in the organization. Let's look at Stop the Bleed. According to the Department of Homeland Security website, Stop the Bleed is a national awareness campaign and call to action intended to cultivate grassroots efforts that encourage bystanders to become trained, equipped, and empowered to help in a bleeding emergency before professional help arrives. The White House launched the Stop the Bleed campaign in 2015 because information obtained from active shooter events have unambiguously revealed that a majority of victims did not have the knowledge base to stop uncontrolled bleeding injuries on themselves or others. In order to stop the bleed, immediate action must be taken for gunshot wounds or other penetrating injuries to impede blood loss, which is the #1 cause of preventative death from trauma, according to Wexler and Flam 2017. Stop the Bleed incorporates a PowerPoint presentation, layperson or community education flyers and posters, hands-on how-to adjuncts with teach-back demonstration methods such as holding pressure, dressing tourniquet application, with an optional train the trainer methodology for participants to become instructors if they so desire. Realistically, this training coupled with run, hide, fight can monumentally increase active shooter awareness and assist with situational awareness or best practices to save lives. You could adapt this to all populations as to what is available in the immediate environment to use as hemorrhage or tourniquet control in an emergent event such as active shooter. Now that we have validated resources, let's look at collaboration. Who do we need to involve? A development team consisting of education, human resources, hospital security or police, quality improvement, patient safety, simulation lab, community resources, and mental health will need to be established along with other entities. Mental health and ethical considerations are needed for an active shooter exercise as part of the preparation. Representation is needed in order to navigate ethical considerations for those with prior exposure to active shooter events in run, hide, fight. The content in active shooter or stop the bleed can both be of sensitive nature, dependent upon background, bias toward gun control use, post-traumatic stress, veteran combat, or prior exposure to active shooter events or victimization exposure of other life experiences. Other factors such as depression or past deployments can also affect reactions or emotions, regardless if the individual was in the front lines of combat. We have discussed multiple factors in design and development for an active shooter exercise. After utilizing our 6Ps, we now want to include putting it on paper in the final phases and process improvement after our post-brief or debriefing. All of these training enterprises, when implemented together, may optimally safeguard or improve outcomes against active shooters in a government or civilian healthcare organization and even include a manual of reference for healthcare organizational use. This has potential to become an excellent training initiative. As discussed, this may heighten safety prevention awareness, life-saving measures for the lone individual, co-workers, patients, families, and visitor or others within the walls of an otherwise potentially devastating active shooter event. As we have our resources and present to key stakeholders, we will collaborate internally and with community as we now look at final preparations for exercise development specifics. One of our specifics is vulnerable populations in the development phase prior to deployment of the exercise. Earlier, we discussed vulnerable populations in government healthcare populations. Why does this need to be considered, and how will we deploy the education? These identifiable high-risk targets cannot be moved emergently due to incapacitating medical needs such as operating rooms, intensive care units, community living centers, palliative hospice units, amputee veterans, wheelchair-bound or elderly patients with the inability for independent extraction. Therefore, these facilities require emergency preparedness plans with strategic implementation, which are consistently rehearsed to navigate both internal and external response for active shooter events. This all-hands-on-deck approach requires initial individual and group training. This training could be proffered in new employee orientation with simulation-based combined exercises to enhance the staff learning experience. when compared to didactic active shooter training alone, which is the norm within most healthcare institutions. In fact, many healthcare facilities have yet to establish a recurrent, ongoing active shooter prevention program and simply mandate an annual online refresher training or check the box with the yearly disaster drill sanctioned by accreditation bodies for inspection standards. Therefore, this innovative strategy has the potential to mitigate rapid responses, higher survival rates, and increase both patient and employee safety for survival in an unforeseen emergent event such as active shooter. This can be utilized for both clinical and non-clinical staff in technological venues, face-to-face, or in simulation exercises or classes. When deploying training, there are a plenitude of factors to look at. One being adult learners who have different learning styles, which require multiple teaching methodologies be incorporated into educational training sessions for knowledge or skill retention. In a 2019 study of operating room personnel with an active shooter simulation training, it showed significant findings to substantiate simulation training for learning retention, such as familiarization with communication strategies, identification of active egresses, location of self-defense objects, understanding safe places to hide, and the recommendation to ultimately deploy to all organizational employees are proof that interactive training sessions with simulation increase understanding of best practices recommended for active shooter events. Key points from this example for exercise design and development are shown on this slide. In a recent study, it was identified that very few medical staff are current and proficient in dealing with penetrating trauma, so Stop the Bleed would be a definitive adjunct to active shooter training for all employees to ensure optimal survival outcomes, according to Perry, 2017. When doing training exercise pre-planning or projecting the outcomes, this training proffered will empower each individual with the knowledge for safety actions to take in an active shooter event, along with strategic life-saving measures for hemorrhage control, regardless of location in an unfortunate emergent circumstance. The outcomes would be essential to implementation of a successful healthcare organization emergency preparedness program for optimal outcomes in a tragic active shooter event. Don't forget your post-brief or debriefing now that we have completed our active shooter exercise. This slide demonstrates key questions which could be asked for what went well or what did not go well, which will put the exercise into perspective for process improvement measures. Unfortunately, in today's world, an active shooter event can occur any day, anytime, any place. But active shooter is just one example of exercise design and development, as you can see from this current slide on modeling and simulation. The impact of this particular exercise design and development slideshow, which incorporates modeling and simulation, would have significant, immediate, long-lasting effects on those trained. Organizations must remain vigilant and empower their staff with the knowledge, training, and skills of what to do in an actual active shooter event, along with the life-saving hemorrhage control methodology to maximize survivability for all involved. After all, what is the value of a life? This is just one example of exercise design and development. Please utilize simulation and modeling in your next organizational exercise to optimize the training experience, clinical skills, and knowledge retention. So the last question I have for you is, what does the future hold for exercise design and development? The answer is truly to infinity and beyond. Modeling and simulation in the 21st century are being utilized in training platforms throughout the world in various forums such as artificial intelligence, space exploration, and cyber warfare. I wish you the best in your endeavors for exercise design and development. In conclusion, be innovative, be in the know, be personally invested in your organizational exercise design and development. Remember, any exercise design or development needs to meet appropriate guidance or review and, if applicable, accreditation standards. Also think about how can it play forward for maximum effect. You've done all the hard work, so look at options to assist other organizations, training platforms, or infrastructures for continuity and sustainability. I am Sandra Walker. Thank you for joining in this learning experience and good luck with your own organizational exercise design and development. Make a difference in your world.